could you tell more about what kind of modern equipment that can apply for cardiothoracic surgery in Mount Elizabeth Hospital?
Firstly, of course, is in the diagnostics itself. The modern equipment is diagnosis is you can diagnose lung cancer surgery in Mount Elizabeth. What we have is one is bronchoscopy. You can diagnose lung cancers by biopsy. Biopsy is very important in cancer because you want to know whether it's cancer. If it's cancer, you want to know whether it's small cell or large cell. And Dr. Lim say you also need the biopsy to do mutation study. So there are many ways to do it. In Mount Elizabeth, we either do it through a bronchoscopy, and or we do a CT scan guided lymph node biopsy. And these biopsies are accurate in almost 90% of the time in our hospitals in Mount Elizabeth. And the second thing is after your diagnosis is very important in lung cancer surgery or lung cancer itself is staging. And in Mount Elizabeth, they have all the latest technology, which is PET scan. A PET scan is very important, where it screens the patient from head to toe to see whether the cancer has spread to other parts of the body. Because from the PET scan, we will know whether the patient is suitable for surgery or whether the patient is suitable for chemotherapy. If there's no spread from the PET scan, we will know that that patient goes for surgery. But if there's evidence of spread, then they go for chemotherapy. The other thing, as I already said, that to the oncologist who gives chemotherapy, if we can diagnose the spread of lymph nodes before surgery, is very good because it avoids unnecessary surgery in patients. So for these patients, you can check the lymph nodes either by what is called EBUS. EBUS is endobronchial ultrasound, where the ultrasound is placed in the bronchoscope, and through the bronchoscope you can biopsy the lymph nodes under local anesthesia in a day surgery setting for most patients. Or in a worst case case, if it's EBUS, that's one facility available in Maoni. The other thing is you can also do a mediastinoscopy, where you make a small incision in the neck and sample the lymph nodes before the surgery. Because if the lymph nodes are positive before the surgery, then the patient is no need for chemotherapy. Now, of course, the last facility is the latest equipment and technology is the facility to do advanced surgery. So through robot or do through VATS or keyhole surgery. So that's the whole setup, not only in terms of technology, equipment, but also personnel. Personnel is very important because you need trained staff to do all these things. All these facilities are what is available now in Mount Elizabeth Hospital.
Thank you, Dr. Agasthian.
I just want to add the point of molecular testing, the pathology. Nowadays, with the targeted treatment, it's very important to have a very good molecular pathology lab service. We used to do mutation tests, like for EGFR, for ALK, for fish. So this test can be done using different techniques, different methods. After the common mutations are tested, if they are negative, there are actually many more minor mutations that if we can detect them, identify them, they are actually additional targeted treatment. So I think it's very important to have a very good molecular laboratory that having the different methodologies to detect all these mutations. The issue is nowadays with biopsy. We biopsy the lung tumor through, let's say, the needle biopsy through the chest using CT scan to guide. Yeah. Because of the needle biopsy, the amount of tissue that we can get is very little. So as we need to test more and more tests, more mutations and more tissues are required. Yeah. So nowadays are shifting from testing individual gene to a multiplex testing where you can test a few genes at the same time using the same specimen. Nowadays with the different technology and next generation sequencing, we can test a few hundred genes using the same specimen. So that will allow us to do a fairly comprehensive test with a small amount of tissue. The other thing is nowadays the drug treatment in cancers, including lung cancers, are developing at a very fast pace. The immunotherapy drugs for lung cancers will just come out the last 2-3 years. And last year it was approved for second line, and 3 days ago it was approved for first line. So the development is very fast. So to do that, so we need a system to allow us to get access to whatever drug, the latest drug that is made available. So we work it through different ways. In Singapore, all the drugs has to be approved by the health authority. But a lot of time, this approval process takes time. So it takes 1 year, 2 years sort of thing. Meanwhile, what do we do with the patients when the medical data is proven that it's helpful? So we actually have an early access program in the sense that before the drugs are formally approved by the health authority, if we have individual patients that we think that the new drug, not approved, but new drug that will benefit the patient, we can actually work with the company and work with our health authority, and a lot of time we can bring in this drug. So not only we need to have the test, we need to be aware, keep abreast what's happening, and there need to be a mechanism to get access to the new drugs.